Good evening, everyone, and welcome to More Than a Woman. My name is Tia Daly, and I have the distinct honor and pleasure of serving as the president of the outstanding and exceptional Zeta Phi Beta Sorority Incorporated, Omega Eta Zeta chapter, serving Southeastern Massachusetts. We're so very honored that you have joined us this evening, and we are ready to engage in this amazing conversation. And as is our custom, we first like to pay homage to our founders, affectionately known as our Five Pearls. These women sparked the vision that allows us to do what we do here today in the world of Zeta. And we also would like to recognize our international leadership, our international president and CEO, Dr. Stacy N.C. Grant, our Atlantic Region Director, the Honorable Beverly S. Tatham, and our Commonwealth of Massachusetts State Director, Sharina D. Wright, Esquire. Again, I am Tia Daly, and we are so very glad that you have joined us this evening. This is our second edition of our More Than a Woman program, and our topic of discussion this evening is holistic versus scientific health. And so we encourage you to be engaged and participate in this discussion. Grab your pens and your pieces of paper and take some notes. Type out your comments in the chat, use your emojis when you get excited or something piques your interest, and just be engaged with us and soak it all in this evening. This program is a creation of our outstanding and exceptional chapter member and moderator for this evening, Ms. Charity Wallace, who serves as the vice president of our chapter. She's endeavored to create a space that brings forth thought-provoking discussions and encourages empowerment in women. And we are so very glad that we are able to present the second edition of this series with you this evening. And we know that Charity and our panel is going to lead us in an amazing conversation that will probably leave us wanting more. And so without further ado, I welcome your moderator for this evening, Ms. Charity Wallace.
Thank you, President Daly, for that wonderful introduction. Good evening, everyone. To all of my sorors, to all of our guests, thank you so much for taking the opportunity out of your evening for this wonderful, wonderful program. I am so thankful that we are in the second installment. And without further ado, I just want us to really enjoy being in the space. But before we do, we have some housekeeping rules that I would like for everyone to keep in mind. In the beginning, this presentation was recorded, so please keep that in mind. This whole panel discussion will be recorded. I also ask that you all stay on mute unless you have a question when we do our Q&A session. As mentioned before, definitely utilize emojis, reactions, things of that nature. That is more than welcome. You can also use the chat feature to ask questions throughout the discussion, and we can certainly ask those questions once we get through the Q&A session. Feel free to use the raise hand feature if you have any questions throughout the Q&A session. Feel free to provide feedback throughout the discussion as well. Any thoughts that you have, any concerns, any type of feedback that you want to contribute to the conversation, please feel free. And finally, relax and enjoy the conversation. Without further ado, I would like to introduce our panelists. First up, we have Dr. Centrisa Greenwich, aka Dr. G, who I want to know is also a member of Zeta Phi Beta Sorority Incorporated. Feel free to add on to the intro. She is a doctor of physical therapy and also a licensed massage therapist. I've been to her sessions. She is the owner of Forever Young Physical Therapy and Wellness based in Stoughton, Massachusetts, and she is also a veteran of the Army, and thank you for your service. Dr. G, do you have any welcoming remarks you want to say before? All right. On to the next panelist. Dr. Laverne Mosley is a licensed psychologist and also assistant professor at the Department of Psychiatry at Boston University. She is also the CEO of Empowerment Counseling and Psychotherapy Center based in Massachusetts and Rhode Island. Welcome, Dr. Mosley. Would you like to say anything before we continue?
Thank you for having me.
Yes, absolutely. All right, going on to our next panelist, Sandra B. Harris. Thank you so much. She is the state president of the AARP, Massachusetts. She is also the co-leader of Massachusetts Task Force to End Loneliness and Build Community. She is the 2021-2022 Gen to Gen Innovation Fellow, and also the 2023 recipient of Friendship Works Catalyst Award. Thank you so much, Sandra. Do you have anything you would like to share before we start?
Just that I'm honored to be here. Thank you.
Thank you. Last but not least, we have Dr. Vanessa Brito. She is the Associate Vice President for Campus Life at Brown University in Rhode Island. Also the Executive Director of Health and Wellness at Brown University. She is a board certified internist and is also a fellow of the American College of Physicians. Thank you so much. Do you have anything to add?
Thank you, Charity. It's a joy to be here. This is a really important conversation. Thank you.
Yes, absolutely. All right, let's get started. So I'm excited about this conversation for a number of reasons. Just for the audience to know, More Than a Woman is a concept that was started based on my personal life experiences as a woman, dealing with a lot of things. And this year, I wanted to focus on more of the health disparities that we as women of color face. So going into the discussion, one thing I realized, and as I was doing my research, was that although we serve only 7% of the population here in the United States, especially Black women, we have a lot of health disparities, whether it's cardiovascular, certain types of cancers, our morbidity, especially when it comes to childbirth, is very high compared to other demographics. And we don't necessarily have all the resources or access to a lot of the help that we need if we are diagnosed with different conditions. And this is why holistic and scientific health is a big discussion that we're having today. So I would like to start off by asking all of the panelists if you can answer this question. What do you feel are some of the key differences between holistic and scientific health in general? And anyone can start.
I'll jump in.
Yep.
When I think about the framing of holistic and scientific, if you will, health, I actually see them on a continuum, and I actually see them as complementary to each other, as opposed to framing them in sort of a dichotomous sort of way. Because I think that there is, when you think of holistic health, you think of treating the whole patient or caring for the whole patient. And I'm hoping that that's what we're also doing with, traditional health, if you will, or scientific health. So, and I also think that, to some extent, we really need to blend them more. And there does need to be some rigor brought to some of the practices and some of the modalities that we think of as, let's say, complementary or alternative or, holistic, if you will. But I see them as being, all of the arrows that we have in our quiver, and we need to reach for them as we need them. Depending on what the circumstances are. And I think it's really, the onus is on practitioners and providers to have, sort of a wide lens when they think about caring for and supporting patients and clients.
Yes, absolutely.
I would,
Go on.
so sorry. I would have to agree, with Dr. Brito and her assessment. There's, both of these things, when we think of holistic health as well as scientific health, they are complementary. They should go together. And we find that in much of the work that we do, and even as, myself as a psychologist, we're talking about a lot of holistic practices that are beneficial for managing these diagnoses that we end up giving to patients on a regular basis. And so even something, if we think about even depression, we're talking about incorporating, exercise, and we talk about wellness. We talk about making sure that you're getting enough sleep. So I agree, like it's on a continuum. There are things that are basic that we definitely have to get back to in order to treat the whole person, because
Yes,
we're more than just a diagnosis. We're more than just, a list of symptoms. And so we want to ensure that we're looking at the entire picture in order to gain, the most benefit, for ourselves, and also for the folks that we treat.
yes. Sandra, I know you wanted to jump in.
I would agree with all of that. And I think more, especially now with the work that I have been doing with the loneliness and social isolation, I think we are really, social beings. We're wired to be connected. And we've spent a lot of time looking at our physical health, which has to do with the body, mental health, which has to do with the mind. But social health is becoming more and more important. And I think it has been the missing pillow. So when I think of holistic health, I think of, the physical, the mental, and the social health. And that's all very, very important.
Absolutely. Absolutely. Dr. G, please.
I think that I understand everything that each woman just said, but I think that's where the two differ. Holistic health and scientific health should go together, but I feel like once we get into practice, we get more like in the scientific health, we get more into evidence-based practice, and sometimes we forget about the holistic piece, the mental, the physical, diet, exercise, everything that you mentioned, diabetes, heart disease, cancer, they all go back to being prevented with diet and exercise. But then when we get into the doctor's office, they don't tell us the how to.
Yes.
Like, I feel like that's the missing piece. Like, you're supposed to exercise, but what if you're in pain and you don't know how to exercise through that pain? We don't get that piece. But as a physical therapist, we tell our patients the same thing. You need to exercise to get better, but then we don't tell them how to do it. And then we miss the other piece. Maybe there's a mental health piece that's missing, and we don't have the time to like really focus on that in the traditional physical therapy sense. We don't have time to focus on the fact that they might be dealing with family issues and everything. So that's part of the holistic piece that we don't get to focus on in the traditional scientific piece.
Yes, absolutely.
That makes
I kind
sense.
of I want to touch on both things. So what you just mentioned, Dr. G, and what Sandra just mentioned with the social aspect. And I would like to understand that a bit more because and maybe you would agree, maybe you wouldn't, but I think a lot of the social aspects or the lack thereof has a lot to do with the history when it comes to how Black women were treated, especially if you're going back to times of slavery where there wasn't access. Sandra, I wanted to ask, how does the history of Black women in healthcare, regardless of if it's holistic or scientific, how do you think it has affected the social aspect today?
Well, I think when we begin to even look at the social determinants of health, right? It's just the environment, that you've lived, that you grew up in, having access to health education or care, health care, having access to housing, food, all of that has impacted us as a race, as Black people, right? And certainly we have not been as included in even the what can be called the scientific medicine or the Western medicine. We had to come up with our own holistic approaches to addressing these because we did not have access to to the other, the scientific portion of it. So I think that has impacted us and has left us with, has somewhat handicapped us. You know, when I think of social health, I think of my family. I grew up in Louisiana and we were tight knit. You know, we lived next door to each other. So, you know, we didn't have a problem connecting. I had, you know, my cousins, I had 7 kids, my parents had 7 kids. I had 6 siblings. So, you know, I had my own football team. I had my own basketball team, right? So we were connected. And I think we began to lose that when we began to move around. So I think as we think in terms of our background, I think the social connection has always been very strong for us as a people. It's just that the other parts, in terms of the medical advice, the healthcare, and even medicine. You know, we think about we didn't go to the doctor to get a pill. You know, if you had a headache, you had another remedy at home that your parents had tested, right, and were able to demonstrate. We were just talking about when you had, you know, a toothache. What did they do? You didn't go to the dentist to be numbed with that one, did you? So I think that I think we just have suffered not just with Black women, but Black men as well. You just have not really had the history of healthcare that others have had.
Yeah, absolutely. Any panelists want to add on to that or kind of discuss that point a little bit?
Yes, you know, I'll jump in. You know, I think that for a lot of folks, even if we think about you know, immigration and folks who have maybe come from other countries to the US, I mean, not have necessarily had the same level of access to insurance or medical care. There are probably some traditional healing remedies that may have come, you know, from their home countries. But once folks got here, they may have also lost a lot of that, you know, early, you know, lost a lot of that early history and a lot of those usual remedies that they may have had in the past. And we start to see now increase in disease and increase in a lot more struggles because folks haven't been able to get in to, you know, to get medicines. And then if we go a little further, you know, on this point, once you actually start with a lot of the pharmaceuticals, there can be a lot of side effects related to the pharmaceuticals that are used as well. So it's like a double-edged sword, right?
Yeah.
So we're seeing, you know, like higher mortality rates in folks who are younger because the food supply or what folks can afford in a lot of minority communities may not necessarily be the best quality. So then that brings in a whole, you know, a whole other piece as well. So we're seeing increase in heart disease. We're seeing increase in diabetes, as well as you know, high blood pressure. And there's such a large number of folks who are struggling with these things, and there could be other ways to manage some of this care. I was listening to an interview recently that was talking about there's a blood test that can be utilized to see the, you know, the amount of blockage in the arteries, but that's not something that's generally you know, given when you go to your doctor. And if it's something that's, you know, that you have to do under private pay, who's really able to afford that? And so it kind of locks out a lot of minority populations from being able to get access to this kind of care. Even if we think about mortality rates with you know, Black women and birthing, that's also something that's huge that happens, you know, here in the U.S., where they may not necessarily be given, you know, the proper screenings for, you know, for when they may go into the hospital. I've had even a very young patient who went in and was complaining of pain and swelling, and you know, she was at the end of her pregnancy, and they sent her home. And then what happened when she returned to the hospital? She delivered a demised baby, right? Because they did not have her stay in the hospital and check her. So there's, you know, these assumptions that as Black women, as minority individuals, that you're able to, you don't feel pain the same way.
Yes.
And it's huge, you know, and so there has to be more advocacy. We have to be able to advocate for ourselves about the care that we actually need, right? And so some of this is actually doing research on our own to really understand what's really good, what do we really need to make sure that we're, getting the proper care. So it's, also about bringing that voice about.
Absolutely. And that kind of speaks to wellness. And that's something I'm really big on. And as a scientist in biotech, it's a lot to really talk to people about vaccine development, because I get all the time, I don't want the COVID, I don't want this. And to try to explain to them why it's important for vaccinations, but cannot tell them to get it. And the other piece to that, with when it comes to wellness, is kind of the physical aspect, which is, exercising. So I kind of want to go into that a little bit for Dr. G, and then also Dr. Brito, definitely feel free to chime in. And it was mentioned earlier that there's certain areas where we don't have access to certain foods or certain remedies for us to use. So in terms of you as in your field, Dr. G, like, how do you encourage your patients to, get some of those types of medicines? Like, what do you do specifically in your practice? Just out of curiosity.
Repeat the question, please. For
Yep.
medicines?
For wellness. So in terms of the exercise, in terms of, just because you mentioned before, there's different types of exercise. A lot don't know, exactly how to do that. How do you encourage your patients to exercise, and what to utilize in terms of foods the right way, just out of curiosity?
I'm not a nutritionist or a dietitian, so I don't really give advice on what to eat. I do know that eating more plant-based options is a good way to go as far as like preserving your health. But as far as the physical aspect goes, exercising, that is my thing. Like physical therapists are movement specialists, so we teach people how to move properly and through certain pain that they have. So if you have knee pain or back pain, then I might have to teach you certain ways to move through that, or how to rehab those things so that you can move better with less pain. And one thing that I try to do is to simplify the process, because we make exercising hard, but it really isn't. Like, you're doing it every single day. If you get up out of your chair, that's an exercise. We do sit to stands all the time with our patients. So if you be intentional about the exercises that you're doing, the things that you're doing, say for instance, you're watching TV and that's your thing, like that's how you relax, but then you want to incorporate some activity into it. Use your commercial breaks as your time to exercise. If you need to get up and sit down, stand up and sit down 10 times and make it simple for yourself. Turn on some music and dance through that commercial break or something. Dancing is a form of exercise, and if it's something that you enjoy doing, then do that. I think you just have to make everything simple. Don't make it so hard. It's really not that hard. But I don't want to make it seem like it should be simple for everybody, because people do have injuries and things that they're dealing with. So going to see somebody like myself to teach them how to move through those pains, I think that's very important as well.
Yeah, absolutely. Thank you for sharing.
I also want to speak to, kind of, again, the continuum of care.
Yeah.
And in my role, I really want to make sure that I talk and work with patients before they're injured, before they're, they may see a physical therapist in consultation, but I want to help them move and start to incorporate exercise into their lives before they're injured. So I really want to work with people in their 20s and people in their 30s, so that by the time they get to be 50 or 60 years old, exercising, walking, simple, as you say, simple things are just part of what you ordinarily do. walking in a group, having an exercise buddy, having an accountability partner. That's the fancy way,
Yeah.
fancy way of talking about it these days, but to just have a friend that, you know, and these days you can use texting to say, hey, I'm going, even if we can't walk together, we can be, we can talk. You can walk where you are, I can walk where I am, and we can walk together. Maybe we do that a couple times a week. Sometimes I tell people, get a couple of heavy rocks or a couple of soup cans if you don't have weights. It's okay. You can use anything that will give you, you know, I'm not a physical therapist, but anything that will give you an opportunity for some resistance, for example. But exercise is so important. It's important for your mental health. It's important for your physical health. It's important for your cardiovascular health, your musculoskeletal health, all of it. So move the big muscles, do whatever you enjoy doing, because that's what you'll do, right? Me telling you what to do isn't going to be the answer. It's really, what do you enjoy?
Yeah.
Walking in the mall, it's really hard for people to walk in an environment that's safe sometimes, or, you know, we just switched to daylight savings time, thank God. And, you know, when it's dark and cold in New England, going outside to walk for some people is not the first thing that comes to mind. But maybe you go to the mall, maybe you put some sneakers on and you walk the shopping mall or the enclosed plaza, you know, a few times. And you do that a couple times a week, leave your wallet in the car. So you're not feeling compelled to buy something. But I'm just saying, I think there are ways to kind of build it into your life, build it into your social connections, your friendship group, your family, and just have it be something that you know brings you joy, because it will pay you in dividends down the road. Just trying to be consistent, I think, is one of the other big things.
Yeah, absolutely. And there's a lot.
Question.
Oh, yes.
I had a question. I just wonder what everybody else's thoughts are on prevention, because I think you mentioned prevention, Dr. Brito, but like I don't think that's like something that people think about a lot. And by the time they get to us, it's often too late. Not too late all the time, but sometimes it's things that we can't remedy because you waited so late to come to us. Like what is everybody else's thoughts on prevention?
I could talk for hours, so I won't.
Well, you know, you know, there's prevention, and then I go back to that idea of advocacy and doing research on your own, right? Dr. Brito, you mentioned, like, you know, being in New England and the cold. One of the things that you know, I talk with a lot of my patients about is, what is their vitamin D level looking like? You know, have you gone and had your doctor check it? I've had many a patient where, you know, that I've sent back to their primary care physician, you know, because they're coming in with fatigue, they're not sleeping well, they're having achiness in their bones and joints, you know, their loss of appetite, feelings of depression and sadness. You know, their skin is pale, they're getting more sick. And this is, you know, for minority folks, male and female. And more recently, I've seen kids who have, you know, gotten, like, you know, very ill. They've been very weak. They're, everything that comes out, they're getting sick, right? So, but the doctors may not necessarily be regularly checking your vitamin D level, right? So part of that prevention is also making sure that you're reading up on, you know, what do I need, you know, as a minority person, as a Black and brown person, to ensure, you know, that I'm okay. If I'm not feeling well, I know, you know, that something's not quite right. Let me go in and make sure that I get that checked. And a lot of the time, you know, I had a you know, a family that I was working with, and I told the mom, I said, I really think that you need to get this looked at, you know, for your son. And she went in, and the doctor, you know, felt like, you know, this wasn't something that they really needed to do, right? And of course, what ended up happening was this kid's level was like at a 7, right? Now, normal low is like a 30. And so you know, so they had to put them on, you know, on a high dose regimen for several months right? And so then we'll start to see, an improvement in mood, an improvement in the sleep, less fatigue. But these are things that we have to know that can occur even, for any of us, right? So it's about, increasing our own knowledge, doing some reading on health and wellness, so that you can then incorporate some of these practices, or go back to your doctor and push the issue that, okay, I think I need some of this testing done. The other huge thing is, also, hormonal imbalances that folks are not necessarily thinking about, and getting hormone testing with their doctor. So this is, about, okay, I'm going to try to learn a little bit more, but there can be thyroid hormone deficiency that's causing folks to not be able to lose weight, that's causing issues with anxiety and mood, and insulin resistance, right? So there are probably a lot of things that can be done, on the medical side, but you need to be able to ask your doctor, can we do a hormone panel? Can we look at this to see if there could be something else going on? And oftentimes they may not have thought about it, right? So you want to look at this care as something collaborative with your primary care doctor. And if they're not willing to do it, know that it's okay to go somewhere else. This is part of um, that advocacy, right? We're seeing a lot of women with PCOS, difficulties with fertility. I'm not. I could get into even my concerns about the food and what it is that we're, eating now, and
Yes.
how a lot of that is just like so tainted, and we really have to step back. A lot of the allergies that we're seeing now, I really feel that it's related and connected, to what it is that we're ingesting. And so we really have to do more, to take charge of our health. So that's holistically as well as, scientifically. And even with some of the non-traditional treatments, you can add some of those to your treatment, alongside your doctor, and it may actually help to improve the functioning of some of the medications that you may be taking. But it's about having that conversation rather than, you go in, it's a 7-minute visit. How do you've waited for 2 hours to see the doctor, and it's like 7 minutes that you go in and see them. But being able to advocate for yourself is huge.
Yes.
I just want to dovetail onto that, because I think that's a really important point. It's unfortunate, but we have a system that's fractured, a healthcare system that's fractured. We don't have enough primary care providers, and I say that intentionally. We've used the word physician. I'm a physician. I'm an internist. This is what my life's work has been. But I think that having a good nurse practitioner, a good PA, someone who's invested in who you are, and who you are as a whole person, and is going to forge a relationship with you that will help you understand what the seasons of your life are, right? So when you are an emerging adult, late adolescent, you need something very different than someone who's in midlife. And someone in midlife needs something very different in the case of women, and someone who is postmenopausal, right? So it's important for us to forge those relationships and have someone spend the time to educate you as the patient, and develop a relationship such that you're comfortable asking those questions, writing them down. I tell people all the time, get a cheapy notebook and just write your question down. There is no question that is silly, no question that you shouldn't ask. And shame on us as providers for not sitting with people and investing that time early on, so that people aren't approaching their care like buckshot and feeling like they have to be in sort of this reactive mode all the time. This isn't rocket science, but it takes developing a relationship for people to really feel comfortable talking with someone about cancer screening, instead of recoiling and running away from it. Understand why it needs to happen, when it needs to happen. And it's okay if you feel fear. Let me, as your provider, help you sort of work through that. It doesn't mean we're not going to do it, Maybe we won't do it tomorrow, but we are going to do it. And so I think those are some of the really important things that we really do need to help people understand, that this is a relationship and we really need to give people space to be informed, educated, ask their questions, and we respond to them in kind.
Yes, absolutely. And I think a big part of that is accessibility, right? The ability to have those questions answered, ability to advocate for yourself. So I do want to ask all the panelists, and I would like to start with Sandra. Like, do we really have that level of accessibility now? And is there a way that we can circumvent that issue? I feel like we all know the answer, but how do we circumvent that level of accessibility issue when it
Well,
comes to that?
I think like anything, some of us have and some of us, and it's probably more than not, do not have the accessibility to that kind of care, including making sure that we have access to proper food, proper nutrition. So I do think that there is a gap, and there is a big gap between the haves and the have-not. We see it every day, and not much has changed with that. So I think we still have a long way to go. I think as the non-medical person on the panel, I'm just loving what I'm hearing from my partners on the team. And I think the most important thing that I take away from this conversation is that we have to know our bodies, right? And we have to be our own advocates. We need to know when something's not right. We need to stay on top of it, research it. And if you don't get the answers, then go to the next person. So I think that I'm learning a lot from this panel, and I think it's very good. But to answer your question, I think that there is a major gap, and where and how we get that, I just don't know how to answer, what the answer is to that.
Yeah. And Dr. G, do you want to answer? Do you have any thoughts?
About advocating for
Yes.
ourselves? I think it's hard for some because I think it was Dr. Mosley who said something, or Dr. Brito who said something about 7-minute visits, right? Like it's hard to get your questions answered in 7 minutes. You can barely say, hello, how are you doing within that 7 minutes and give an honest answer. So knowing the other professionals that you can go to, like an internist, like I can't think of the nurse practitioners. There are other providers that can spend more time with you than your regular primary care physician can. So being able to go and see those other professionals as well can give you more access. But just not being afraid to seek other help. Like you get assigned or you choose your primary care physician, but then a lot of people just stick with that same primary physician no matter what, because they're the professional, they know better, right? So instead of just staying with them when you know that your body doesn't feel right, know that there are other places and other people that you can reach out to figure out what's going on, because some doctors just won't, they don't feel a need. Like if you need a full blood labs done, some doctors won't see the need for pulling like all of your hormones, but the answer might be in those hormones or the blood labs that they're not pulling. So reaching out to other professionals or other doctors to get those answers or the questions answered, I think that's important.
Yeah, absolutely. Dr. Mosley, did you want to add anything? I know you're on
Yes,
mute.
I think it's helpful to, go in with your list of questions. If there are things that, I would definitely encourage that, write down the questions that you have. If folks have access to their doctors through maybe a mic chart, or some kind of online portal where they're able to send their questions, or you have your agenda, that these are the things that I want to be able to address during my next visit, that's going to be helpful too, because that will also prompt the physician to say, okay, this is how we can plan out the visit. So please make sure that you're recording those things. I have patients that will put in, this is the agenda, these are the areas that I want to be able to discuss today, and so that keeps me on point with making sure that I'm meeting the patient's needs.
Recording in progress.
Yep, absolutely. I actually want to, I see a raised hand has been raised for a while. We actually have someone in the audience that has a question. So Malkia, go ahead and unmute yourself and feel free to ask your question. If you can unmute.
I think she placed her question in chat as well. Her question
Okay.
was address the shortage of medical professionals and the lack of desire to become a medical professional.
I'll take some of that, not all of it, but some of it. It's a huge issue. It's a complicated issue. It's a big commitment for people to go into, let's say, into medicine. The debt that people walk away with is just unbelievable. And we're talking about primary care, sort of accessing a primary care physician in this case. And, they're at the bottom of the heap, right? Pediatricians, family docs, internal medicine docs, bottom of the heap, relatively speaking. And so you're coming away with all of this debt. It just feels insurmountable. So a lot of people coming out of medical school are going to some of the super subspecialties where the compensation is better for whatever reason. But as my sisters have been talking about, there are many ways to touch the elephant. There's PA school, there's NP school. There are ways in which people can you can be a physical therapist. I have an occupational therapist who is in my family. I have, other folks who are really mental health providers, people who are very invested in caring for people. But in terms of primary care, it's really complicated. So there are some medical schools now that are opening and are specifically focused on training primary care providers. Some on the West Coast, we have Quinnipiac and Connecticut. There are some that really have that driven and baked into their mission, but we need more. We need more. And some of it, I'll be honest, the healthcare environment is such that people, are really, sort of looking at how, relatively speaking, how they will make a living for their, for their families, et cetera. So we need to think about what insurance reimbursement looks like for primary care and start to balance things out a little bit more. So it's a complicated, and that's just the tip of, the iceberg, not to mention the time invested and, and all of that. So it's a complicated thing, but we need to do more of it. And where I am at Brown, Brown is a huge commitment to primary care. That was the track that I was on, and continuously beat the drum. My husband and I established a scholarship specifically for underrepresented minority medical students at Brown to help ease some of that medical debt, so that when people go in, they know that at least I'm not going to be so overwhelmed that I won't be able to even think about, continuing to realize my dream of being a primary physician. And the other thing that I think is important is that we don't have a maldistribution. We need to distribute primary care clinicians more evenly. So, they're all on top of each other in some places, and then you get to other areas and it's either a mental health desert or it's a primary care desert. There are people who are desperate to see a physician and have to drive, literally in Massachusetts, have to drive, an hour and a half or 2 hours to get to a primary care appointment. So So I'll stop there, but it's a complicated issue, and I think it's a really important one, and one we should really start to look at really honestly.
Yes.
I have many thoughts on this, many thoughts that start even, at the elementary school age, right? And just starting even from schooling in a lot of minority communities where the rigor oftentimes is not there. And so there may be a desire to go into the medical field, but they're not equipped, even from, grade school going into high school, and are not prepared. And they may start out with this desire once they get to college that this is what I want to do, but they have not been equipped to handle the rigor of the work. And so we see a lot of falling away in many STEM careers. And medicine in particular. So that's so if you haven't been able to have the background, it makes it very hard to achieve that goal. But just as Dr. Brito mentioned, like there's certain places where you will be able to provide or see a large number of physicians in a certain area, and or physicians that look like us in a certain area. But in other areas, it really is a struggle. So I think that we have to start very early on to ensure that we're helping folks to be equipped to handle what it takes to get through a program.
I have one little thing to add. I think representation is important.
Mhm.
Like for me, I knew I wanted to be a physical therapist since I was 10. But I didn't know that that was an option for me because I never seen a Black physical therapist until I got into undergrad and I did my first internship. I did my internship at a gym, and in that gym was a physical therapy clinic, and that physical therapist was a Black woman. And I asked a question. I was like, what did it take for you to become a physical therapist? And she really just took me under her wing at that point. She took me on as her intern. So I had 2 internships. But she modeled what a good provider was. She taught me the ropes of like evaluating and listening to your patients and stuff like that. But she also was a mentor. I could ask her any questions that I had about physical therapy. So I think that if I had never seen her or another Black physical therapist, I probably wouldn't have become a physical therapist just because I didn't know that was an option for me. So I think that's important too.
Yeah. We have another raised hand. So Marcus, feel free to unmute yourself if you want to ask, or you could put it in the chat as well.
Yes, so hello everyone. I know Dr. Greenidge just literally touched on this subject in terms of representation for her going into her respective field, but can you all explain how representations in your field have affected the um, patient outcome, if that makes sense?
I can answer that question. I mean, when I came to Massachusetts and started at Boston Medical in the child and adolescent psychiatry department, there were not a lot of minority professionals or minority psychologists that were in that department. And it was almost like I mean, in a way, it was kind of overwhelming for me having patients say, like, I've never had a Black psychologist to see my child, and there are folks at BMC who've been, they're generations of folks who have been able to receive their care there. And it really touched me, and that's part of the reason why I'm still there, because I feel that representation does matter. And even though I have my private practice, it's like I want to be able to be a voice and a presence for folks to be able to feel comfortable while they're there. And I feel that there's a deeper understanding of the lived experience for a lot of folks, and just being able to see someone who looks like them when they come into the room, it's almost like a lot of the defenses come down, and you're able to have a real conversation about real things that are going on in your life. When I was in Philadelphia and the work that I did there for years, I did a lot of in-home work. And so I was, going into people's homes. And so you had to, be able to create a sense of welcoming and a sense of comfort, and I feel that that's something that I've extended even into the office. And so I've seen improved outcomes. There are patients that I've had for years who really feel that they benefit from that relationship and that connection. And so it's important for me, for as long as I'm able to be there to be that face and that voice, I'll be there.
Thank you for sharing that. I kind of want to expand on that just a little bit before we continue on into questions in a few minutes. Do you all feel that you are and I can speak to the representation because in STEM there's not a lot of representation either in analytical development, manufacturing. Do you feel that where you are in your respective fields that the representation has gotten better, and how are you all kind of an advocate for that change?
I could take a stab at that. So I have been in my role at Brown for about 6 years. I came back just before the pandemic, and it has been hugely important to me to be sure that representation is considered whenever any of my staff are hiring. And so I'll give you an example. In our counseling service, this may sound a little hard to believe, but in our counseling service, 85% of the staff who see students identify as staff of color. On a university counseling service, that's pretty extraordinary. And 53% of the health and wellness team it also identifies, and that's across the spectrum of almost 200 people identify as people of color. Now, not all of them have been hired since I got there, but it is hugely important to me, and everyone knows that that's something that we all have to take very seriously, because our demographic is global, and students come from all over the world. It's an example that I think is important, no matter where we are, to really push, and push again, so that we can advocate on behalf of the patients that we're going to be seeing, so that the people sitting across from them look like them, they can identify with, they can be open with, and to also sort of infuse some cultural humility into the work that people do, so that when they approach someone, they're not approaching it from the standpoint of knowing and understanding everything. They have to leave their egos and their privilege at the door. And so we spend a lot of time, on that training, and really there are high expectations that we're going to do our best to meet students where they are in our case. And I think it's a huge issue.
Absolutely. Sandra, specific to your role at AARP, can you kind of speak to that and how you kind of assist in advocating, for all the individuals you work with and work for?
Well, again, as with AARP, the demographic is a little different from what we're discussing now, but I have spent a lot of time in academia. So I do agree with Dr. Brito, and have kind of seen that happen at different campuses where we do not have the representation, and the risk and the issues and challenges that as a result of that, students especially students of color, just don't feel comfortable going into these spaces asking for help, especially in the mental health area. At ARP, we advocate for, again, trying to make sure that we advocate for society where all people get to live their lives in a way that they choose how they want to live and how they want to age. In my experience in the Massachusetts office, we really have really encouraged and advocate for a lot of people of color and women of color. I don't know how many of you are familiar with the Grove Hall area. We have a very, very active chapter of Black women there, and they're extremely powerful and advocating for those kinds of things like Social Security and Medicare and Medicaid and all the kinds of things that we try to do. A big issue for us is caregiving, and we see people of all colors, and especially in our community, that's a special passion of mine, making sure that we get healthcare information and resources to communities, because I'm a long distance healthcare, and if anyone's been a healthcare provide healthcare, know that that's a very critical issue. So I guess it's a personal banner that I wear, and am continuing to carry that banner and advocate for people of color. But it's a very, very, very important for all of us.
Yeah, thank you so much for sharing that. And I have one more question in relation to that before we kind of jump into questions. There's a financial component to this as well. So, a lot of times there's a lack of affordability or unsure of where to get the financial resources. So could we kind of speak to that a little bit? Like, are there ways that we as Black women or even Black men can find resources to go to a doctor's office and figure out what therapies we need, whether it's scientific or holistic? And anyone can jump in and speak to that.
I would say that
I
even,
have, oh, you
go ahead, go
I see
ahead.
the wheels turning.
No, I'm thinking of it from a prevention piece. I know, like, we can't all afford to go out of network, but I think if we do some comparisons in like how much we're spending on treating a condition versus prevention, or going the membership route. I forget what it's called, like concierge doctors. If we go a concierge doctor route versus in network, like the cost difference, I think we can look into that, because if you think about copays and deductibles, if you're spending money a monthly amount at a concierge doctor to see a concierge doctor, you might not spend as much money as you would going the insurance route, because your deductibles are so high. Like for me, my family deductible is like $8,000. So if I take my son to the doctor in the beginning of the year for his allergy doctor, we took him one time and his allergy appointment was the bill was $600. Like, who can afford that on a regular basis? Like, if you go to one of these concierge doctors, you might not end up paying that amount because you're paying it on a monthly basis. So, like, cost comparison might be important.
Mm-hmm.
I don't know.
Yeah.
If that answers your question.
Yes. Anyone else want to speak to that?
I would agree with the preventative route, because what you end up paying after, when we think about a lot of the care for cancer, or all of the medications for diabetes. It's like, if we can start from the beginning, right, or start much earlier to do what we need to do to care for ourselves, then that's going to help in the long run to reduce some of these costs. Now, even if you're on public assistance and you have public insurance, right, there's still nothing wrong with being able to utilize that insurance in a larger health system, right? So if you go to someplace like a larger hospital, I think that you may be able to have access to more resources than if you're in a smaller clinic. So if I think about, and maybe I'm a little biased because I, I am at Boston Medical, but I feel that if you go in and you have your doctor and you say, okay, I think that I'd want to be able to look at this, and regardless of what your insurance coverage is, they're going to try to make that happen. Right. And, even if if all of your care is there, and I think about other providers that I've collaborated with around care for patients that I see on the mental health side, and we've been able to do a little more or get people in sooner, right? So being able to connect with a larger system that may have more access to different, you have a lab on site, GYN is on site, cardiovascular stuff is on site, so being in a larger system may provide or allow for more access than being in a smaller clinic.
Yep. That totally makes perfect sense to me. And I think as of now we have one hand raised. So I apologize if I say your name correctly, but Valeta?
So it's Valeta,
Valeta.
which is fine. So a couple of things. So I think Dr. Mosley is right when you think about larger hospitals having the ability to offer more services, and the rates may be smaller. I've worked at two really large companies in my work life. I'm now 67, so I really am old. And I've always utilized my flexible spending money that both institutions offered. And so, every November I would start kind of thinking about, what I might need to have access to. So, maybe I need to have, a new crown put in, maybe, I need different asthma meds or whatever. And so I've always, put aside extra money in a flexible spending account because the companies offered it. And my attitude was, you know what, if I didn't use it at the end of the year, I knew it was, it was a gamble. But it was better to actually have the money in place when I needed to use it. And I also used it, when I needed to get braces for my kids' teeth. And so that's kind of how I was able to manage some of the bigger medical expenses. Just a thought. And then the other thing I want to think about or just talk about as we're aging, and this may be more, a question for Sandra, but it probably is a question for all of us, is kind of how do you put the social pieces in place so that you age in a way that's healthy?
It's one of the things that we're working on. And I think one of the first things that I would say is just, we have become so polarized. I mean, when's the last time you went out and talked with your neighbor, right? So it's just a matter of just connecting to the people who are closest to you, picking up the phone and talking to someone, especially a loved one that you've not seen in some time. It's about reaching out to your neighbor who might be ill or living alone. It's about going to places like and I don't like calling it a senior center because senior centers are no longer senior centers, but I can't wait to get to this line dancing class on Tuesdays at 10 o'clock at Grove Hall Senior Center, right? So, I mean, it's just taking the time to do it. I think one of the things that COVID has taught all of us is, it has really caused us to kind of draw within and to stay within, because I have to be very intentional myself to go out and do things. So I think it just takes very much like exercise, and what Dr. Berto was talking about, how you just kind of do little things by exercise and just to making the time. I mean, going to church, staying over and saying hello, having a cup of coffee with someone at church, right? And I think we just have to be very, very intentional. I think one of the things that has happened to us is, again, going back to my childhood, I grew up in a large family, but we're dispersed throughout the US. We never see each other, right? So I think we have to be very much intentional and mindful of the fact that we need to stay connected. We are social beings and we need to be around other people. It's about being spiritual. It's about believing in something greater than what's going on around us. So I think those are the kinds of things that when I talk to seniors, especially with this work that we're doing, is just remembering who we are and all the wisdom and all the power that we have. And that just as we're looking for someone to connect with, someone is looking for us. And, just volunteering is an excellent way to get involved. When you give back to others, you reap a lot of benefits from that. So those are just some of the things that we encourage people to do. There's a program that we're pushing now. It's called Generations Over Dinner, where you just have a dinner party and you try to get as many generations around the table as possible. Because just as we are lonely, the most lonely, socially isolated cohort today is between ages 18 and 29. And that's a very serious business because these young people are so depressed, they have ideation of suicide and all these other things, and it's a big problem. And I think it's something that we all have to, it's a co-generational effort to resolve.
Thank you for answering that question. I have a few more questions in the chat, so I'm going to start from the first one from Tia. What are things that can be done when one feels that their doctor is not serving them well? What are some of the resources that can be used to assist in that case? Yep.
Two things come to mind quickly. One is it's important to give people feedback. There's a way to do it such that people can hear you. And so I think it's important to say what's on your mind, try to be factual about the things that aren't working for you for whatever reason. I think pretty much every physician is very sensitive to the patient satisfaction these days, and there are often things that are tied to that. So I think it's important to provide that feedback, if not to the physician or the nurse practitioner or PA, to the practice manager. So I think that's important. And I think you vote with your feet. To the extent that you can, find someone else, whether it's for a second opinion or, maybe you're not throwing the baby out with the bathwater, but you want a second opinion about a particular question, vote with your feet. Talk to other people about someone else that they might be seeing, or, there may be other ways to get recommendations for alternative providers. But those are two things that come to mind. Give them feedback and vote with your feet.
Any other feedback regarding that question before I go to the next?
I think
agree.
I agree.
You can go ahead.
I agree, and I think giving feedback is extremely important. And I'll just share a personal story if I can. I remember it was during COVID. I was on a telehealth visit, and it went well. And after talking and giving me a good report, he said, "Well, I'll see you in 9 months." And my response was, "Well, aren't you going to ask me if I'm sad, if I'm isolated, am I lonely?" And he says, "Well, you've got some beautiful art on your wall, that you look good. You should be doing okay." I said, "My father died 2 weeks ago."
Right.
And he was stunned, and he says, "Well, that really is the role of your primary. But I have to tell you that the next time we had a conversation, he did say to me, "Thank you for bringing that to my attention. I'm now taking time to ask my patients how they're doing."
I agree. I agree because uh for me as a physical therapist, some people come to me because they've had negative experiences at other places, and you can't be afraid to go elsewhere because you think that your provider, I said this before, but a lot of people think that their provider should know everything. We're not fixers, but they can get it wrong sometimes. So being open to going elsewhere and just seeking a second opinion, and from a massage therapist point of view, don't be afraid to speak up because sometimes we don't know what you're feeling. For example, in massage, if somebody's giving you too much pressure or not enough pressure, we won't know if you don't say it unless we're looking at your face and your face is like either disgusted or like you're in pain. But just don't be afraid to speak up and tell the provider how you're feeling. I think that's important.
I agree as well. You know, I've had conversations with patients, and I've been open to hear, what are you feeling? Do you feel that this is going well? Do you feel that you want to continue? I do think that it takes special kind of person to be able to hear, like, no, I think that we should, be doing something a little different. But, I've tried to make sure that I'm open because I'm here providing a service, right? And, if I'm not helping you to achieve the goals that you have set in mind, I'm of no, I'm not of any use, right? And so I want to make sure that the process is something that's collaborative. But I agree with everyone that you need to actually say, whether, this is working or not, and to also be open or be willing to go and seek that second opinion. That's okay. That's your right. Because if I was thinking there was another show that I was watching. This woman was really concerned about the fact that she kept having this postnasal drip and was just kind of getting written off as oh, it's just allergies, it's allergies. And she, started to do some of her own research and went for second opinions and found out that she actually had a cerebrospinal leaking from her from her spinal column. But this is something that she knew that, okay, something's not right and this should not be. And so she continued to push, and I've heard multiple cases of that. And so never be afraid to go and continue to check and push, because it's your body. This is the only life that you have, and you're going to be your best advocate in making sure that you're getting the care that you should receive.
Absolutely. Absolutely. Thank you all.
Can I tell a quick story? So I worked in multiple outpatient clinics, and I think sometimes you have to pay attention to the not the environment, but just how the clinic practices. Because I remember one patient specifically, encounter specifically, where a patient came in and I asked her, "How are you doing today?" And she started telling me how she was feeling. And then my supervisor came to me after that session was over and was like, "Next time you need to either pass them on to the aide, or you need to charge for another unit for that time." So the insurance, if the insurance isn't paying them for that time to really find out how the person is doing, like what are they supposed to do? Like, would you really stay there for at a company who doesn't value that time to just find out how you're doing today? Like you said, somebody could have just lost their parent, or the kid could have just told them that they wanted to commit suicide. I've had somebody come to me with that. So how can I really expect them to put their all into a physical therapy session if they're going through those things mentally? Like, I don't think that's right. But if you feel that if you go into a place and the energy isn't right, you might need to go somewhere else.
Mm-hmm. Energy is a big thing for me. I'm very in tune with that when it comes to choosing my provider and choosing who's going to take care of me. So I'm
Energy
definitely
is huge.
that. Absolutely. So I have a couple more questions. I think there's 3 more. Kind of speaking to the concierge that was talked about earlier. What are the best places to identify a concierge doctor in Massachusetts? Or is there a best place?
Google.
Ah!
I think that's the only place that you can go really, because
Yeah.
I mean, I don't know. You could go to the big hospital websites. I think some of the big hospitals do have concierge doctors in there, but just making it more aware that that's a thing. I think that's something that we need to know too, because we think that insurance is the only way. I'm not saying that we shouldn't use our insurance, but insurance isn't the only way. And just knowing that concierge providers is a thing.
Yeah.
I know that I believe it's Mass General that they have a concierge concierge clinic that's part of their larger their larger system. But yes, I guess Google is the the best way.
Next question. Thank you so much to the wonderful panelists. I am wondering your thoughts on how community organizations might be able to strategically, support healthcare practices, both holistic and scientific. Does anyone want to take a stab on that one? Nope. We can move on to the next question. We might have to come back to that one.
One thing that comes to, small thing that comes to mind is, I think that there is, whenever organizations, I'm just gonna use the Brigham, for example, really understands and wants to plug into the community that's around them. Meeting people where they are is really important. So it might be, approaching a church or a community group, approaching one of these large tertiary care centers like the Brigham or BMC, et cetera. They all have community affairs departments, and saying, we'd really love to have a health fair at our church, or we'd really like to have a group of speakers come and talk to our men's group, or those are ways in which they can feel more connected to the community that they're serving. And so it can be a bi-directional relationship. And I think it can feel intimidating, but all it takes is a phone call, and all they can say is no. But chances are, if there's enough lead time, if you're planning something, let's say it's March, if you're planning something in the summer, for example, calling Dana-Farber or calling the Brigham or calling BMC or someone and saying, we'd really like to organize something at our community center. Can you help us think that through? And are there some people that might come and give us some good information, so we're not relying on Dr. Google? Dr. Google can be helpful, but we really love to talk with a real live person.
But like community engagement departments, I know that we have
exactly.
And I know that they've done things in a lot of community events, so they'd be invited to come out, even just to hand out pamphlets or hand out information at various activities. I remember being at something for football, no, a basketball camp in the summer, and we had information that we gave out. There, different things that get organized, and we've had talks at various places or even at schools, talking with young folks, about mental health. So just reaching out to community engagement departments could probably, you can really, develop a relationship with them, and they'll be open to coming out and talking with you.
Yeah, absolutely. I think this is the last question. I'm just scrolling down. Okay, and this is a question I was wondering as well. Because I don't take vitamins because I don't know what to take. And so the question is, what should we look for when selecting quality vitamins for ourselves and family members? Only because when you go into the store, a lot of the vitamins are not controlled by the FDA. It's not a type of drug that the FDA, and me working with regulatory, they don't provide information. It says it on the label. So what should we look for?
That's a challenging, it's a challenging one. And some of it is, being able to do some of your own research. I know that, there are a lot of benefits of omega-3 supplements, a lot of the fish oils. But Nordic Naturals is a brand that I use that also has the least amount of mercury, which is something that, we make sure that we want to look for in a fish oil supplement. But I would say that probably doing some research on different brands is probably the best way to go. Probably even being able to go in and talk with a naturopath or doctor uh, uh, regarding supplements that they may be able to recommend for you would be helpful too. But there's also a life, goodness, which one is it that I've also used the life extensions as an option, and then also for so I use that for my vitamin D, and for my vitamin B, I use Ingenus, which those you're able to get on Amazon. I mean, we didn't really talk much about some of the what the deficiencies may look like, but there's also magnesium. I use a BioEmblem brand for the magnesium that I take.
I think two things come to mind. One is, and this is not to be pejorative, but I would stay away from some of the, how do I say this without getting into trouble? Some of the really, 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 really inexpensive stores that are like a little over 99 cents.
Mhm.
because some of the vitamins and things that they import can be contaminated. We just heard, a horror story about cinnamon being recalled. So so stay away, if you can, stay away from buying things in places like that you ingest. The toothbrush might be fine, or the aluminum foil might be fine, or the greeting cards might be fine, but stay away from the things that you put in your mouth and go into your system. That was a big, broad blanket of that's what I would.
Yeah. Can I share something scary? Can I share something scary, even along those same lines? Just talking to a patient today about the recall on some of the the pouches, like we get so caught up in the pouches that folks give to their babies, with what is it, yogurt and things like that, and that there were high lead content found in those things. And we know that high lead exposure can result in cognitive decline, right? When we think about what happened in Flint, Michigan with the water supply, there's a lot that we have to really pay attention to in our communities. And yes, you may have to pay a little more to get these things, but you really have to pay attention to how these things are impacting our bodies, right? Because once you start losing, or once there's a cognitive decline, or your full scale IQ starts going down, you don't get that back. And so there are a lot of kids, even who had increased or raised lead levels in Flint, where they saw, a decline in their cognitive functioning. We have to be mindful of that too. What's your water supply? We heard about, what recently happened in Stoughton. They're saying that there was a disgruntled employee who flipped a switch to not have the water purified. They're saying that it didn't go out to the communities, but you wonder how has something like this happened in the in the past. So we have to keep our eyes and ears open.
Yes.
Be vigilant. The other thing I would say is, to the extent possible, this is where we get back to, the basics of our diet, and, making sure that you're eating a healthy diet. And I know that there are lots of, and I'm not a nutritionist either, but I do know that, having your plate be 2/3 full of vegetables, and lean cuts of meat, and small servings of carbs. I mean, I think these are important things. And there's this old adage about don't eat anything that your great grandmother wouldn't recognize. If your great grandmother doesn't recognize it, don't eat it. Right? So snack on nuts, snack on fruit, snack on the things that you legitimately know what they are. And the less we stay engaged with sort of the ultra processed foods, the more we have the macronutrients and micronutrients that we need. There are lots of vitamins, and I know that this is a huge industry, but some of the vitamins that we take in are water soluble, and they go right they find their way into the water stream. So try to get the balance that you need from the food that you eat. That's the best way. Use your gut to take in the macro and micronutrients that you need. And a good multivitamin probably doesn't hurt anybody. But you can probably skip the iron. If you really, really are iron deficient, go get a legitimate iron supplement. The amount of iron in a multivitamin isn't enough to do anything but just constipate you.
That's good to know. Good to know.
Can I share a resource really quick? There's a book that I've been listening to, an audiobook, called The Busy Brain Cure by Dr. Romy Mushtak. I think that's her name. But she does share a list of healthy or like good quality vitamins that you can purchase. So just, I don't know if you can even see it, but just The Busy Brain Cure by Dr. Romy Mushtak is a good resource.
And I could put this in the chat as well as we kind of close out.
Just added a
thank you.
resource.
Appreciate it. First of all, thank you all for this wonderful discussion. I didn't realize when myself and the committee did this topic that it would go into so many different things, but this is the discussions that we need, because there's so many aspects to thinking about what works for us. And each person, even though we all, we all people of color, our care is also individualized as well, based on the needs that we have for our body. So as we close out, I would love the panel to kind of give final feedback regarding just the discussion that we have, and just some insight to everyone that's on this call on, just next steps and what you've gotten out of this discussion as well. And I'll start off with Sandra, please.
Well, I've certainly learned a lot. And I would just like everyone to know that, this is our life, it's our body. This is not a trial run. And, this is our trial run. We have to really get it right this time. So it's important to us. We need to know our body. We need to do the best that we can to be our best advocate and to live a life that's long and healthy and with vitality. And it's all up to us.
Dr. Mosley, please.
Yes, I think that, this was a, really dynamic discussion, wonderful discussion, a lot of good information. And, I think that the takeaway that I would say for everyone is that you're the best advocate for yourself. And you know your body and you know yourself. And you have to put in the work to do the research about what's going to be in your best interest in order to get the care that you deserve. And don't expect that you're going to know everything right off the bat. It's going to take some trial and error, so we have to be kind to ourselves. We're not perfect, but put in some of that, that reading, listen to some podcasts, and it may kind of spark something in you to be able to talk with your doctors about. Write those things down so you don't forget, and go in and make sure that you're being that champion for yourself that you can be.
Absolutely. Thank you. Dr. G, go ahead, please. If you have any.
The only thing I would say is like I'll share my favorite quote by Benjamin Franklin. It goes, "An ounce of prevention is worth a pound of cure." I say that all the time, but I can't stress it enough that you have to do your part to prevent these things before it becomes an issue. And prevention, if I could share a personal story really quick, it's not always about like diet and exercise. It's also about getting early screenings and stuff like that. My mother was diagnosed with breast cancer at the age of 40. She beat it, but then it came back at 48. But she was laid off from her job, so she couldn't afford to go to the doctor to get screening. She knew that it came back, but she couldn't afford to go to the doctor to get it screening. And by the time she was able to get to the doctor, her breast, the lump in her breast was like the size of a baseball. So like that lack of access to healthcare is big in prevention. But if we do know that something is not right with our own body, we might need to do an emergency room visit or something like that. I don't really advocate that, but sometimes you might need to do that because you know your body. So doing your part to prevent these diseases and injuries and things like that, I think that's going to be key.
Absolutely. Dr. Brito, please.
Thank you. Oh, I just want to say thank you for this amazing opportunity, and certainly meeting all of you has been truly a joy. Having an opportunity to sort of think and talk with all of you about the importance of caring for ourselves always energizes me. And I think that what I would offer is just three things. One is to really slow down and think about what it is you need, and then think about how you can be kind to yourself. That's physically, that's emotionally, that's spiritually, and then be in community. Because you're right, someone said that we are in this culture where we value independence and sort of doing it on our own and all of that, but none of us can escape being part of the human condition. And so the ways in which we're going to stay vital is to stay in community. So rely on each other, pick up the phone, find an exercise buddy, find someone to line dance find someone to have a cup of coffee with, and enjoy it. Enjoy the time together, enjoy the connection, enjoy the community. Life is short. it's much shorter than we think it is. And so take the time to get to know yourself and the things that are important for you to be the healthiest you can be.
Yes, thank you. I must say I've learned a lot today. And also being in the field of STEM, I'm still learning how to take care of myself the best way that I can. And learning how to be patient and kind to myself as well in the process, because there's so many aspects, as you've all mentioned, that can affect your health, and understanding the choices that we have, especially as women of color in this healthcare system. So I just want to thank all of you for your time and the opportunity to really share your stories and your guidance and your counsel, and to be a light to all of us on this discussion piece. But before we go, I want to turn it over to our president, Tia Daly, just to go over some last items.
Wow, that's all I can say is wow, that was a lot. That was a lot of information, and I feel like we probably could have gone on for about another good hour or two. So that tells you that there might be a third iteration of More Than a Woman. So stay tuned. I know Charity is shaking her head, and so first and foremost, I would like to thank everyone for joining us this evening for our second iteration of More Than a Woman. And a special thank you to all of our panelists this evening. But I mentioned Sir Wallace because Sir Wallace is the chair. So thank you, Sir Wallace, for chairing this with your committee and being our moderator this evening. Such an impactful conversation and taking away, staying in the community and being the champion for yourself and making sure that you get the Busy Brain Cure book, which we've dropped in the chat. But thank you all for being here. Thank you to our sister chapters of Zeta Phi Beta Sorority Incorporated who joined us this evening, and also to our fellow sister Greeks from the Divine Nine that joined us as well. And we also we thank our community supporters that took the time to register and join us this evening. And we hope that we've accomplished the goals of uplifting, educating, and sharing with you all today. So as we close, we just want to remind everyone that you can follow our chapter with Zeta Phi Beta Sorority Incorporated, Omega Eta Zeta chapter on Facebook. And we are Z5B _ Omega Eta Zeta, or you can scan this wonderful QR code that is on the screen and join us and see what some of our updates for our upcoming program and events are, such as, drumroll, we have our 12th anniversary that we'll be celebrating on Saturday, March 16th, which is this upcoming Saturday. It's our 90s paint night, and it's being held in Canton, Mass at Modern Party Arts from 2 p.m. to 5 p.m. And so we'd love for you to join us as we celebrate our 12th year of service to Southeastern Massachusetts. So come back, take it back to the 90s and enjoy. We got a dope playlist. Our committee has put together a wonderful 90s music playlist. And if you're feeling artsy, if you're artsy, and if you're not artsy, sometimes it's just good to put some paint on a canvas and relax, relate, and release. So if you're so inclined, feel free to put on your door knocker earrings, your Timbs, your baggy jeans, and get artistic with us again with March 16th. The proceeds from this celebration event go to our initiative for the March of Dimes, the March for Babies and Prematurity Awareness. The ticket sales will go through Friday morning, so you have until Friday. Again, you can check us out on our Facebook page and our Instagram page, or you can scan our QR code to get tickets. So thank you, tech team, for bringing it back for me. And I just want to say, let's make sure that we're remembering that our work here doesn't end. It's up to each and every one of us to continue supporting and uplifting women in our communities. And we are got to take action and continue to advocate for change and stand together so that we can create a space for us as women to be valued, heard, and empowered. So again, and thank you to the More Than a Woman Committee for putting this together. Thank you again, panelists, for engaging us for an amazing discussion. Let's make sure that we continue to impact change. Thank you all for being a part of this journey with us, and we hope to see you on Saturday, March 16th. Have a wonderful evening, and we'll see you at our next event.
Okay.
Night.
Good night.
Thank you. Good night.
everyone. Thank you.